Why are people with advanced COPD often malnourished? So, when I was in nursing school, I really didn't understand why that would be the case. When I thought of COPD, I thought of the respiratory system, and I didn't really make the connection between COPD and insufficient nutrition. But there are several reasons why this is the case. So, first of all, individuals with advanced COPD often have decreased intake due to just being out of breath when trying to eat or drink. So, if you can imagine running really fast and huffing and puffing and then sitting down and trying to eat or drink, it's really hard. Another contributing reason is that individuals with advanced COPD are often depressed, which can lead to decreased appetite. In addition, individuals with advanced COPD often have decreased physical activity, which also decreases appetite. And finally, individuals with COPD have increased energy needs due to the increased work of breathing. So they need extra nutrition, but they have a hard time getting that nutrition in for the reasons I shared in this video.